Pnawn da. Dwi'n falch iawn o fod yn siarad gyda chi heddiw yn fy rôl newydd fel Gweinidog, Iechyd, Meddwl, Llesiant a'r Gymraeg. Dwi am sôn heddiw am y cymorth sydd ar gael i helpu pobl gyda iechyd meddwl yn ystod y pandemig. Ond dwi eisiau dechrau trwy roi rai o ffeithiau a'r ffigurau diweddara i chi. I'm pleased to be speaking today in my new role as Minister for Mental Health, Wellbeing and the Welsh language. And I'm going to start by giving the latest facts and figures to you. There are now more than 250 cases of coronavirus per 100,000 people in Wales. The highest are in Rhondda, Cynhadledd, Blaenau Gwent and Merthyr Tydfil. In these areas, we've seen rates higher than 500 cases per 100,000 people. Today, Public Health Wales will confirm a further 1,200 cases of coronavirus in Wales, but the actual number of infections will be much higher. As Andrew Goodall said yesterday, 1,275 COVID-related patients are in hospital at the moment, and this is the highest number since late April, and we're getting very close to the point when the NHS reached its peak demand in mid-April. And it's with much regret that I tell you that Public Health Wales will today report a further 44 deaths. And my thoughts are with those who are suffering, and in particular with their families in mourning at what is a very difficult time already for all of us. We've provided, even before the pandemic, 1 in 4 of us were likely to experience a mental health problem at some point in our lifetime. Coronavirus has impacted on many people's physical health, but it's also taking a toll on people's mental and emotional health and well-being across the whole population. There are those who are feeling more than just a general sense of frustration with this pandemic. Many are struggling with feelings of anger, of anxiety, depression, fear, worry, and even hopelessness. Too often, though, many overlook or fail to recognise their increased anxiety. They try and ignore the negative feelings and they hope they'll go away. It's really important that we can acknowledge these feelings and that we can talk openly about them. And I want you to know that if you're experiencing any of these feelings, there is help and support available to you. In Wales, we spend more on mental health than on any other aspect of the NHS, £700 million a year. And during this crisis, we've provided even more support. There are a wide range of services available in Wales, from what we call talking therapies, which include courses and information which can be done online, all the way through to high intervention services for people who are seriously ill. We've invested heavily in early interventions and online services, such as Mind Cymru's active monitoring. We've invested in young people's mental health toolkit and Beat's eating disorder helpline. And we've provided £1.3 million to support the rollout of Silver Cloud this year. Now, Silver Cloud is an online cognitive behavioural therapy service which provides a 12-week course for people with mild to moderate anxiety, depression and stress. The service is supported by a team of psychologists and online cognitive behavioural therapy coordinators. It started as a pilot in Powys and is now available more widely. And already 2,000 people have signed up in just 8 weeks since its launch. These talking therapies don't replace specialist services, but they give people more options and easy access to support designed to reduce demand on local GP services. We've also provided funding from a range of regional approaches to reduce suicide and self-harm, including bereavement support, training and awareness raising. We've provided £10 million to make sure university students have access to mental health support and suicide-safer measures during the pandemic. And today I've announced a further £3 million to provide a helping hand to people looking for work or permanent accommodation, and for people struggling with mental health or substance misuse problems in the midst of this pandemic. This vital funding will provide early, targeted support for the most vulnerable individuals in a preventative capacity to reduce the escalation to often complex needs. I ni'n agosau at ddiwedd y cyfnod atal byr. I ni wedi gofyn llawer wrth bobl drwy gydol y flwyddyn yma, ac I chi wedi ymateb bob tro. Dim ond gyda'ch cymorth chi yn wnaethon ni lwyddo I arafu'r coronavirus yn y Gwanwyn. A gobeithio byddwn ni unwaith eto yn gallu arafu'r coronavirus yn ystod y cyfnod atal byr. Gofalwch am eich gilydd a daliwch I gefnogi eich gilydd. We are approaching the end of this firebreak period. We've asked so much of people this year, and you've responded at every time. It's only with your help that we're able to turn back the tide of coronavirus in the spring, and I hope we'll once again be able to turn the tide of coronavirus over the course of this firebreak. Please look out for each other and continue to support each other. If you need someone to speak to, our mental health helpline is available 24 hours a day on 0800 132 737. You can also access support at the NHS 111 online. Diolch yn fawr I chi gyd. Now I'm happy to take questions from journalists, and all of the questions and the answers will be broadcast live on our social media channels. So, the first question from Catherine Half-Jones, BBC Wales.
And Gweinidog, os allwn ni gael yr atebion yn Gymraeg ac yn Saesneg os gwelwch chi'n dda. Care homes have told BBC Wales that problems with the routine testing of staff are causing a lot of concern and anxiety for them, one telling us they often wait 4 days for results, and many saying they've had to wait at least a week for results. The latest official weekly data shows that 1,000 tests from care homes took more than 3 days to come back. This delay has been described as a ticking time bomb for care homes. What are you doing to tackle this?
Well, we're trying to use this time during the firebreak to speed up the testing process in Wales to make sure that we don't have a situation where we see a spread of the virus within those care homes. We have to recognise, however, that whilst that spread is happening in our communities, there is clearly an increased risk for those care homes. And we're also anxious to make sure that people who want to visit people in those care homes who may be in very desperate trouble, who it may be their last opportunity to meet their loved ones, have an opportunity to do that. And that's why we've created guidance to make sure that they can visit in a safe way. So improving that testing is what we're trying to do during this firebreak period. I ni yn gobeithio defnyddio'r cyfnod yma yn ystod cyfnod byr I sicrhau ein bod ni'n gwella y ffordd ni'n cael ymateb oddi wrth y profion yn arbennig pan I ni'n dod I llefydd gofal. I ni wedi gweld bod cynnydd I weld yn cymunedau ni, ac wrth gwrs mae hwnna'n mynd I gynyddu y risg i'r llefydd yna lle mae hyn bobl yn ymgasglu. Mae'n bwysig hefyd bod ni'n rhoi cyfle I bobl sydd eisiau mynd I ymweld â pobl yn y cartrefi gofal yma, bod nhw'n cael cyfle I wneud hynny mewn ffordd saff, a dyna pam I ni wedi creu guidance I sicrhau bod hynny hefyd yn bosibl.
Diolch yn Gweinidog. Yr ail gwestiwn. In response to delays with the processing of tests in UK lighthouse labs, the Health Minister Vaughan Gething back in September said that the Welsh Government was going to ramp up the use of NHS Wales labs to process more tests. So why are 68% of tests still processed through lighthouse labs, the same percentage and a similar figure as well to what it was back in mid-September? Why haven't we seen that shift yet?
Well, it does take a while for that shift to feed through the system, but that is something that we have been focused on during the firebreak to try and shift the emphasis from the Lighthouse Labs to the Public Health Wales approach, which has been a lot more successful. And of course, if you look at our test track and trace results, they are significantly better than the results that you see in England. I ni defnyddio'r amser yma I geisio dal I fyny gyda'r sefyllfa yna, lle I ni mynd I weld cynnydd, a bydd y cynnydd yna dwi'n siŵr yn dod trwy yn ystod yr wythnosau nesaf yma, wrth i ni symud o fod yn llai ddibynnol ar y system Lighthouse sydd yn dod o Loegr.
Diolch.
Can I ask Nick Powell, ITV?
Thank you, Minister. I'd like to ask you about the impact of the restrictions on meeting friends and family. It can't be done in an informal way, in an unregulated setting. It has to be by appointment in a pub or a cafe. Aren't you worried that will work for people who are younger and fitter and better off, but leave elderly, vulnerable and poorer people lonely and isolated?
Well, thanks very much, Nick. Of course, we have made it clear that we are allowing people to mix with one other household during this time in order to specifically address the issue that you're talking about. And of course, we were concerned about the fact that many people had created bubbles which didn't work for young people. And this is one of the reasons why we were keen to reopen hospitality, to give people an opportunity to mix in a regulated environment. And of course, that regulation will be very clear. We'll be publishing guidance either today or tomorrow on how people are able to come together in cafes and pubs. But also, of course, we want to make it clear that the availability of meeting other people, you can also, of course, meet people outdoors, and that is an opportunity as well.
Thank you. Pub, cafe and restaurant owners are telling us that they fear the restrictions, especially the social distancing requirements, will be hard to enforce and will make their businesses unviable. Are they right to consider simply staying closed?
Well, we've been having very detailed discussions with the hospitality sector, and it was clear that there were concerns about these strict new measures. What we're doing is we're giving people the opportunity to open if they choose. We're not forcing anybody to open, and of course there will be opportunities for people to access finance if they decide that it's not possible for them to open under these new circumstances. Can I ask Daniel Bevan from LBC for his question?
Thank you, Minister. Good afternoon. Staying with the hospitality industry, but focusing in particular on border towns, is there going to be a restriction for people coming in from England whilst they're in the middle of their lockdown, but we've come out of the firebreak? Will that be legislated? Will companies be fined if they don't enforce it? And how will you be checking? Can I get that answer in Welsh and English, if that's all right?
Of course, people in England should not be moving. They have had an instruction to stay at home, and that's what, of course, they should be doing. If people do try and cross the border and do try, for example, to gain access to hospitality, our test, track and trace system, which will now be effective for everybody going into a pub, will mean that they will have to give their address, and it'll be clear that they shouldn't be frequenting that establishment. Mae'n glir bod beth mae pobl wedi cael ei gofyn i wneud yn Lloegr yw i aros adre. A dyna beth ddylen nhw fod yn wneud, a dylen nhw ddim fod yn croesi'r ffin. Os bydd pobl yn ymgeisio mynd at tafarn, mae yn angenrheidiol nawr iddyn nhw rhoi eu manylion nhw o ble mae cartref nhw, a bydd hwnna'n dangos yn glir bod nhw wedi torri'r gyfraith. Felly, ni ddylen nhw fod yn dod dros y ffin yn ystod y cyfnod yma.
Thank you. And can I ask this answer for Welsh and English as well, if that's all right? Of course, we're in the middle of the US election. In your former role as International Relations Minister, I think you're quite well placed to speak on this on behalf of the Welsh Government. What do you think it says when the leaders of the free world, or potential leaders of the free world, are claiming victory in an election that's very clearly far from being called?
Well, I think it is important that any leader respects the democratic process, and the democratic process should be allowed to run its full course. It's clear that there are implications for Wales in relation to who may win the election. Climate change is something that we feel very strongly about in Wales, and there are very different views on climate change in relation to the two candidates in the US election. So it will have an impact on us. The strength of the US economy will also have an impact on the economy of Wales. So this is not something that is that won't affect us. And of course, we, I suppose, from the Welsh Government point of view, would call on all of the candidates to make sure that they respect the democratic process and allow it to run its full course. Mae ddiddorol I weld y ffordd mae'r atholiadau yn yr Unol Daleithiau yn gweithredu. Wrth gwrs, mae'n bwysig bod pobl yn parchu y sefydliad democrataidd, bod ni'n aros I gyfri pob pleidlais tan bod ni'n clywed rhestr terfynol ac I wybod pwy sydd wedi ennill a pwy fydd yn arlywydd newydd yr Unol Daleithiau. Mae'n mynd I gael effaith arno ni yma yng Nghymru. Wrth gwrs, mae ddau candidate gyda agwedd gwahanol iawn enghraifft ar newid hinsawdd ac I ni wedi ymrwymo at gweld gwella mewn newid hinsawdd yng Nghymru ac wrth gwrs mae'n glir bod rhaid I bobl aros tan y broses wedi mynd trwy'r broses yn llwyr cyn bod ni'n gweld gwahaniaeth a bod ni'n cael y canlyniad cywir ar ddiwedd y dydd. Can I ask Will Hayward from Wales Online?
Thank you, Minister. Can you explain in simple terms the science and rationale behind why I am able to meet 3 people, all from different households inside a pub, but I can't meet one member of my family from outside my household in my garden?
Well, what we wanted to do was to make sure that we allowed people the opportunity to meet in a controlled environment. And we know that pub landlords have a long history of being able to control their own environments. What we don't know is how that will happen in people's homes. So we want to give people the opportunity to meet each other and that in a controlled environment. We're allowing 2 families to get together within the home and now effectively we're allowing people from 4 different households effectively to come together in a regulated environment, and that's the fundamental difference.
Okay, and yesterday we covered an inquest into the death of a young woman who took her own life after her mental health consultation was cancelled. Today the parents of a Red Cross volunteer have said she was failed by mental health services before she took her own life. Do you think mental health services have enough capacity in Wales, and how do we ensure that people in such vulnerable places get the help they need in the future?
Well, what we're trying to do is to make sure that we ramp up our mental health capacity. Already we are putting significant funding into this, but mental health is not about just the money that we put into the health service. We've got to see this as something that is much broader than that. This is about job security. It's about family relationships. It's about debt. There are lots and lots of reasons for why people suffer mental health and anxiety problems. But what we need to do is to make sure that the services are available to them. We've adapted those services during the coronavirus pandemic to make sure that people can still have access. It was set as an essential service during the peak of the pandemic, and it's continued to be so. And so that access was there the whole time during the pandemic process. But what we're trying to do is to make sure that there are easier ways for people to access, in particular online.
So you do think there's enough capacity right now in the system?
I think that there is capacity in the system, but we're ramping it up. So we've seen an increase in the number of people, for example, calling our call centres. We've seen 2,000 people access the Silver Cloud advice line. If we find that there is a need for more support, then obviously we will look at putting in that additional support. At the moment, we think that the important thing is to put the support in at what they call level 0 or level 1 support, which is very early stage intervention to stop those problems from building in the first place. But can I just say that I'm very sorry to hear about any case, in particular where people have taken their own lives, and obviously any case where there is a suggestion that there's been a failure on behalf of the government or the health board in any way, we will investigate. Steve Bagnall, Daily Post.
Thank you, Minister. Some people are obviously struggling with mental health issues amid the outbreak. Are there any other indicators of the effect the virus is having in areas such as homelessness, drug abuse, excess drinking or domestic abuse? Have there been rises in these areas too as a result? And if so, what else is being done to address these issues?
Well, you'll be aware, Steve, that we've put considerable funding into getting people off the streets, in particular at the beginning of the pandemic, and we've continued to put that money in to make sure that we can put as much support as possible into. A lot of people on the streets have mental health issues. What we've been able to do because of that is to put a wraparound care support package in place to make sure that they have what they need in terms of support from us. We don't have any evidence yet of an increase in drug abuse, but we are aware that there is a likelihood that unless we take early steps to intervene, which is what we're doing with this package of measures we're announcing today, we are likely to see problems in that space.
Thank you, Minister. And Christmas is approaching, and I appreciate, although we can't see exactly what the situation with coronavirus will be coming into the festive period, is the Welsh Government looking at best case, worst case scenarios based on projections to give people some sort of Christmas to lift spirits and their mental health?
I think Christmas is something that obviously a lot of people are focused on, but we have also got to focus on the fact that we've got to turn the situation around in Wales. And you've heard from the figures we've heard this morning that we're far from doing that at the moment. We are hoping that this firebreak will go a long way to trying to stem the incidence of the virus. Of course, we understand that Christmas is a really important time for families throughout the country, and we will be looking at how, ideally in a cross-UK way, that we can work together to make sure that people can get together. But there are no guarantees of that at this point. We've also got to consider that a lot of people are alone at Christmas, and that is something that we need to consider as well in our thought processes. Gafon ni Iolo Jones o Golwg.
Yn hawn da, Gweinidog. Iechyd i cydnabod pwysigrwydd technoleg a platfformau digidol i ddyfodol y Gymraeg, ac un o'r sefydliadau reini sy'n arwain ei gad yn hyn o beth yw Canolfan Bedwyr, Brifysgol Bangor. Yn ôl adroddiadau BBC, mae'r cynlluniau ar y gweithiau trythuro'r Ganolfan, mae sylfaenydd a chynbenedd Ganolfan Dr Ken Williams wedi dweud bod hynny'n gyfystyr â chwalu'r sefydliad yn llwyr. Fel Gweinidog y Gymraeg ac o ystyried eich ffocws chi ar y Gymraeg yn byd technoleg, tybed beth yw eich barn chi am y sefyllfa a ddylai Llywodraeth ymyrryd hyd yn oed?
Just to repeat the question from Iolo, the question really was, with the emphasis on the Welsh language, on the importance of technology. There's a particular issue at Canolfan Bedwyr in North Wales, which is based in Bangor University, and there is a proposal at the moment to restructure the centre, and I'm being asked whether that is something that we have concerns about as the Welsh Government. Just to be clear, that we have had discussions with Canolfan, with Bangor University about the situation in Canolfan Bedwyr, and understand their proposals for a restructure. Technology is absolutely central to what we see as a key element in the future use of the Welsh language, which is why Canolfan Bedwyr is, in terms of the work that they do, very important. But this restructure, I'm sure, will not get rid of the essential work that they have been doing over a number of years.
Wedyn o ran fael gwestiwn... Chi
eisiau fi ateb yn Gymraeg?
Ie, byddai hynna'n delfrydol, bydde.
Diolch. Jyst i wneud yn glir bod ni wedi bod yn cael trafodaethau gyda Prifysgol Bangor ynglyn â'r sefyllfa yng Nghanolfan Bedwyr. Mae'r cynllun technoleg yn holl bwysig i'r ffordd yn ni'n gweld dyfodol yr iaith Gymraeg, ac wrth gwrs mi fyddwn ni yn parhau i weithredu gyda Prifysgol ym Mangor a sicrhau bod y gwaith sydd wedi cael ei wneud yng Nghanolfan Bedwyr yn gorffennol ddim yn cael ei colli.
Gret, a wedyn o ran yr ail gwestiwn, mae fe am y cynadleddau yma'r Wasg. Mae 10,000 os nad ragor wedi bod yn dilyn y cynadleddau yma trwy gydol yr argyfwng. Heb os mae'r sesiynau yma wedi bod yn gyfle i godi proffil Llywodraeth Cymru. Wedi gweud hynny, prin iawn i'r defnydd o'r Gymraeg gan weinidogion a newyddiadurwyr, ac mae'n werth nodi, os na fyddech chi'n medru'r Gymraeg weinidog, byddai'n rhaid i fi ofyn yng nghwestiwn ni yn Saesneg. Felly, mae gweinidogion yn sôn beth y beinydd am normaleidio'r Gymraeg, bod tybed awr Llywodraeth yn colli cyfle fan hyn i godi proffil y Gymraeg ac i'w normaleiddio.
Just to repeat the question, that the suggestion is that the press conferences are an opportunity for the Welsh Government to raise a profile of the Welsh language, and we haven't seen much of use of the Welsh language in these press conferences, and wouldn't this be an opportunity to normalise the use of the language? Wel, dwi'n fach iawn heddi mod i wedi cael cyfle i ddefnyddio'r iaith Gymraeg, ac wrth gwrs mae'n bwysig i gydnabod bod yn bosibl i bobl cael y gwybodaeth sydd angen wrth Twitter a llefydd eraill hefyd. Ond wrth gwrs, beth sy'n bwysig yw bod pobl gyda'r cyfle i glywed yn y lle cyntaf beth sy'n digwydd yn ein cymdeithasau yn arbennig pan mae'n dod i coronavirus, a dyna beth ni'n ceisio wneud yn y press conferences yma. Just to say that we are making every effort to make sure that there is an opportunity and there always has been an opportunity for people to raise questions in Welsh, as we've done this morning, and I hope that situation will continue. Diolch. Daniel Barnes.
Very much. Is there any evidence that the coronavirus burden on mental health is falling more on those on lower incomes and less well-off areas, or is it more universal?
What we have seen in evidence is that people who already suffer from mental health issues are more likely to suffer more during the pandemic. People on lower incomes are also likely to suffer, and one of the things that we're keen to do is to make sure that we put in place some advice in particular in relation to debt. So there's a whole programme now being undertaken in relation to debt support, especially when people are concerned about losing their jobs. So there is a relationship, without question, of people on lower incomes having those increased concerns and anxieties about how they're going to put food on their table.
Thanks very much. And Vaughan Gethin released a statement a short while ago saying that asymptomatic testing would now be carried out at a more local level. So is this something we can expect more of? Well,
every day there are developments in this space, and of course we will see how the initial pilot works, and then of course if that is successful we will see that being rolled out. So all of this is pretty new. The pandemic is something that we never heard about before last Christmas, and so we've got to just understand that all the time there are opportunities for us to attack this virus in a different way, and we hope that this will be a method of doing that as well. Nathan Shoesmith.
Thank you, Minister. Many people use sport and exercise to help manage their mental health, though during the 5-week lockdown and the lockdown earlier this year, indoor leisure facilities have been closed. As gyms and leisure centres have shown that they can be COVID safe, and because of their benefits to mental health, many have called for them to be prioritised in terms of staying open. What's your view on this, and do you envisage the possibility of such facilities being prioritised in the future if there are further 5-week lockdown periods?
Well, we've made it clear during this fire break that we would like to see people exercising outdoors, because that is important to help their mental health. We have been very clear in this fire break that we wanted to see a pretty strict fire break so that we could limit the amount of time that the fire break took. And that's why we closed indoor leisure centres along with almost every other facility apart from schools. And so, of course, they will be reopening when we come out of this fire break, but we will have to continue to assess this. But you are right in saying that they have so far proved that they have been able to manage COVID in a safe way by reopening. But we will keep an eye on this in future.
Thank you. And another question, how much is people's mental health part of the discussions taking place around Christmas, and also in other decisions around restrictions? Is this being given a similar weighting in discussions compared to the direct physical health and economic impacts of the pandemic?
We've been clear right from the beginning that mental health is an essential service. It has not been shut down during the pandemic. We are very aware that Christmas is something that people focus on as a time for families to get together. We are not able to give any detail on what Christmas will look like yet in terms of being able to mix, but we are keen to see if it is possible for us to do that on a four-nation basis across the UK. Diolch yn fawr.